Hey everyone, and welcome back to the Claims Theory podcast. I'm your host, Lindsay Gross. All month long, we have been digging into one of the most critical and misunderstood themes in healthcare: data. What does it mean to be data driven in an industry as complex and regulated as ours? How do you go from reporting to real change? And most importantly, how do you build a culture where data is used, trusted, and acted on? Today's guest knows exactly what that takes. I'm joined by Carly Wagner, clinical data scientist at Red Sail Technologies, with a master's in data science and analytics, a background in statistics, and hands-on experience architecting systems and building reporting tools for healthcare. She brings a unique and practical lens to how organizations can make data work for them. Carly, welcome to the show.
Thanks for having me. I'm excited to be here today.
I'm so excited to have you on. So Carly, let's just start with your story. Can you share a little bit about your background and what your day-to-day looks like as a clinical data scientist?
Sure. As you mentioned, I earned my bachelor's in statistics and my master's in data science and analytics from the University of Missouri. I've been in healthcare analytics for about 8 years now. I started as a data analyst tasked with building an entire enterprise data warehouse that led to architecting and engineering data pipelines to ingest data from a multitude of practice management systems, internal applications, and even EDI claims data. My typical day-to-day now as a clinical data scientist still consists of that analysis and engineering that I was doing early on in my career, but I also support other engineers and analysts with what they're working on and helping them grow their skills as well.
Got it. Your parents must be so proud.
I think so, yeah.
Yeah, and I love hearing the blend of technical skill and industry knowledge. Healthcare really does require that balance, doesn't it?
It is, and it's very difficult to do. Thankfully, being in the industry for so long, I've been able to get a very good basis down. But yeah, it takes several years to understand the industry. And even if you've been in data for years, it's so hard to pick up the healthcare aspect of it.
Absolutely. Your role seems like a bridge between raw data and real decisions. And I think
Yes.
I think that's why, so many organizations fall short, because to your point, it really is a challenge to bridge that gap.
Absolutely.
So you've been working in healthcare data for years now, as you've said, and we hear the term data driven thrown around constantly. In your experience, what does it really mean to be data driven in healthcare, and what separates the organizations that say it from those that live it?
It's as simple as using the data to drive every business decision. It will tell you what's going on in your business and where you should focus to improve processes to make your business better. And if you've got the data but you aren't using it, you're losing out on the potential that you could get and gain from having that data at your fingertips.
Yeah, and being data driven isn't just about having access to the data, it's about using it to change something. So many
Mhm.
organizations have dashboards, and great dashboards, but no one's looking at them on a regular cadence or trying to use them to really solve for real operational problems.
Very true. And sometimes it's hard to get them to kind of buy into that, but I think it's really important for the data team to support the business as much as they can in allowing them and helping them learn what the reports are actually showing and how they can be useful to really help the business in the decisions that they need to make.
Yeah, absolutely. And I think that kind of, it brings us to another important point, which is leadership. And
Mhm.
you can't build a data-driven culture without leadership. What role does leadership play in shaping how data is used across the organization? And what happens when leadership isn't fully bought in?
Exactly. So adoption starts with the executive level leadership. And if they're not bought in, the lack of adoption trickles down through the rest of the business and the leaders that are in place. And so that leads to misalignment in the business's decisions that they're making and how they run as a business.
Yeah, and I've seen firsthand how even a single engaged leader can change the entire tone around data just by asking better questions in meetings.
Yes, exactly. And I've seen it too, where the highest level leader is in the weeds doing the work himself. And that trickles down to the rest of the team, showing that data is important, but get in and start learning what's going on in there, ask questions, and it can change everything for your team.
Yeah, 100%. And sometimes too, in healthcare and revenue cycle management specifically, it can be really easy to get caught up in just the speed of delivery, or total volumes, and not necessarily about the outcomes and the quality. And sometimes it can signal the wrong message to the broader teams. But again, to your point, you're getting in there, you're asking questions, and you're keeping everyone engaged so that people are focused on what story that data is trying to tell everyone.
Yes, 100%.
Yeah. One of the biggest challenges I see, everyone looking at data through their own lens, in
Yep.
every organization, we all might be looking at the same thing, but we see it a little bit differently, clinically, operationally, financially. How do you bridge that gap and get cross-functional teams speaking the same data language?
Yeah, so it really starts with making sure that you've got data normalization in place for all of those teams so that they're using the same data set at the core to do all of their analysis so that in the end, they're using and utilizing the same data that allows for them to see the same results, right? They're not getting data from separate places that may not align with the other places where the other teams are getting their data. That's
Absolutely.
huge, but also another thing that helps really that the data team should be providing is a data dictionary of all the terms and definitions that are useful for the business to understand the data even further.
Yeah, I think that's brilliantly put, Carly. Getting data from multiple places and it not being normalized, which is, the misalignment is where so much friction happens in organizations, and different departments are optimizing for totally different goals. So all the
Yes.
more reason to have it normalized with a team that knows what they're doing.
Yeah, I've seen firsthand several instances where two different teams are using data from different systems and they're producing different outcomes and then there's the question of okay, well, which one's correct? And you take away the that kind of like which one's correct, all of the questioning that you're doing and then trying to track it all down when it's all centralized, you don't have to worry about that.
I think you mentioned too defining and definition. Sometimes just getting people in a room agreeing on definitions is half the battle.
Yes, and terminology, 100%. There's so many different terminology
Yes.
words that you could use to talk about the same thing, and when, you're not all on the same page, it gets confusing.
It's highly nuanced, which is again why it is so complex. Yeah.
Mhm.
So let's shift into something that I think you and I and a lot of other healthcare leaders care a lot about, and that's clean data. In
Yes.
your opinion, what are the biggest challenges when it comes to data hygiene in healthcare, and what makes our data so messy?
It's as simple as the front desk processes for data entry. If they're not clean when they're putting in the patient demographics, that leads to so many issues in your business that could have been avoided from the get-go.
Absolutely. And data integrity is such a foundational issue. And you're right. You're totally right. It usually starts at the front, the beginning, how the data is being input, where it's being input, and it rarely gets leadership attention until something goes wrong.
Yes.
And maybe not in every organization, but probably pretty often no one's paying attention to it until something goes wrong, and then all eyes are on that particular department or process.
Exactly. Seen it
Yeah,
happen.
exactly. I always say if you don't trust the data, you won't act on it. And that's where the momentum dies. It's clean data going in so that the rest of the machine can actually produce clean data. So I'm curious for the leaders out there who think their data is solid, but maybe haven't really looked under the hood. Are there red flags they should watch for that might indicate their data isn't as clean or trustworthy as they think?
Absolutely. There's several key performance indicators that the leaders should be tracking, including their clean claim rate and denial rates, which will indicate messy data and lead to larger issues.
Yeah, absolutely. So in other words, yes, there are definitely some red flags, and to your
Mhm.
point, several KPIs that can be indicative of a problem.
Right.
And I think one of the biggest red flags is when your team starts working around the data instead of with it,
Mm.
which we've seen happen over and over again. Or when you're spending more time validating reports than using them.
Yeah. Doing short-term fixes is not the answer. Go back to the beginning of the process and clean it up from there. And that's how you get better. That's how you get better data and better outcomes.
It's a team effort. It always is.
Yes.
Keeping the team engaged, keeping everyone on the same page, and again, getting that buy-in from leadership so that everyone is marching in the same direction. Let's say a healthcare leader knows they've got a data mess, but doesn't know where to start. What's one small but powerful first step they could take to start improving data quality?
It's really putting in process these data entry and quality assurance steps from the beginning that will make a huge difference and impact for your business.
Yeah, so sometimes simple wins, even something like creating standard naming conventions or
Yes.
data entry protocols can go a long way.
Absolutely. And it's not always easy in healthcare when you don't control your system that you're working in, but having kind of guidelines of if you're entering this piece of particular data that it should be formatted this way so that everybody's in alignment and knows what they're doing, and the data that's going in is going to be clean so that the data coming out is also clean.
Yeah, and maybe too understanding who all gets visibility or get visibility into who and how many people are touching the data and how, who has access to make those changes. Is probably another great place to start.
The people at the front desk who are not putting the data in clean, that leads to the rest of the team trying to track down and spend more time that they probably should be focusing in other places to track down the patient's demographics to clean them up. It just leads to everybody then having to be responsible for cleaning up the data when we could have avoided it.
Right, which then leads us into the culture of data. And we can't talk about data culture without people. People will always be an integral part of everything we do. How important is data literacy at all levels of the organization? And what does good training or enablement actually look like in practice?
It's so important that you have good training that starts on day one and it is an ongoing process in your business. But I'll say that it's so hard to implement good training, and it's not a one size fits all kind of answer that I can give, because what may work for one company doesn't work for another, and that's okay, but you just keep trying and find what works for you. I've never found a complete, like, this is 100% the best way to do training, because people are different and they learn in different ways. And so you just kind of have to take it step by step and make changes as you go to see what fits best for your employees and your organization. And that's really it.
Yeah, adapting and innovating. And it's not just about training people on tools. It's about helping them know what to look for and why it matters. And
Mhm.
again, it kind of goes back to the why, explaining the why to people. They're more likely to engage and care a little bit more about what they're doing. I think the most dangerous thing is when someone thinks they understand the data, but they don't fully grasp the source or context.
Absolutely. Always ask questions. You can't go wrong when you ask a question, right? You're always going to learn something, and it doesn't hurt, right? You get more understanding. Everybody gets more understanding when there's questions asked. I always recommend ask questions whenever you can so that you can understand what's going on in the data.
Yeah, and it goes back to being curious. I think on every podcast I've done at this point, being curious almost always comes into the picture somehow. Ask questions, be curious, figure things
Hmm.
out, and
Yep.
trust but verify. So Carly, you've worked with tools like Power BI, SQL, others, no doubt. In your
Hmm.
opinion, what makes a data tool actually stick and get adopted by teams instead of just becoming shelf?
Absolutely. I think what I've found most is that when an employee can jump in and use a base clean data set that the data team has provided for them, that's the best way for people to continue to use it, right? If they're spending the time to go in and understand what the data looks like and make visuals that help them look at data, right? We all interpret things in different ways. I think maybe best as a table, somebody else may want to look at as a graph. And so allowing the end users to really control their visualizations, I think has been the biggest indicator of stickiness, right? Several tools that can do it, and it's as easy as implementing them and allowing the team your team to go in and use them is the biggest thing that helps them to continue using them in the future.
Yeah, that makes sense. They're kind of a part of maybe the visualization that they like. To your point, not everyone absorbs information the same way. Maybe they like to look
Hmm.
at it in a bar versus a graph or vice versa. And I think for me, the best adoption I've seen is when the tool is actually when it actually answers a burning operational question. And that's when I think people really start engaging with it.
Absolutely. And again, if you are letting them kind of do their own self-service analytics, they can ask those questions and see what they get. And even if the first time they are looking through the data and trying to build something, if it's not correct, keep trying, you'll get there. And again, ask questions if you don't know how to get there, and somebody can help.
I think a lot of organizations, we've all been there, are trying to solve real problems. But, I've
Mhm.
also seen tool fatigue. And sometimes, there are so many dashboards out there floating around and none of them actually ever get used. So again, just goes back to what operational problem are you trying to solve? What data are you trying to visualize? Who's looking at it? And do they understand what's there?
Mhm.
And are they looking at it in a way, to your point, that they understand?
Right. And I think when, you start having analytics build dashboards for the end users, they don't always know what the end user really needs and what
That's a
business
good point.
problem they're trying to solve. And so if you are going that route and it's not self-service, having a collaborative effort between the business and the team building the reports is so important. It helps everybody in the long run, cuts down on the time to get reports correct, because if you put them out there the first time and they're not correct, but it takes somebody a while to kind of review them and start using them and realize that they're not correct, you've wasted time getting to that point where if it's collaborative throughout the entire process, then everybody's going to be happier at the end.
Yeah, totally agree with that. So it goes back to the right buy-in from leadership so that people are engaged with the
Hmm.
process through the process and so that the end result is one that works for everyone. There's a lot of work that goes into building those tools, as you very well know. So spending the time to do it, you're hopeful that the folks you're building it for are going to use it.
Yes, absolutely.
So let's zoom out a bit. Where do you see the future of healthcare data heading? And what are you excited about? What are you keeping a cautious eye on?
I think the biggest thing in healthcare, which is biggest in every industry right now, right? It's AI and machine learning. And how does that fit in healthcare? And I think that's the future we're going, whether that's larger scale or just, individual organizations implementing it for themselves. And for me, what's most exciting is being a part of that, right? I'll be on the front lines building out those machine learning pipelines and the AI tools that the business will be able to use. And that's so exciting. But there's always a potential for security risks that's involved with using AI. And I think just being cognizant of that and not letting it slow down or stop progress, but being aware that, introducing these tools creates a lot of security risks that, especially in healthcare, we need to be aware of. And the fact that PHI is so important to protect, right? All of the data that patients are providing to our organizations.
Absolutely. And cyber attacks happen just about every single day. So to the point you just made, cautiously optimistic for all of the new tech that's hitting the healthcare market today around AI, around machine learning. And I'm hopeful about increased transparency across the board, but concerned about over automating before fixing foundational problems. I think it all
Hmm.
comes back to, is your foundation solid before trying to add on really cool tech and tools?
Absolutely. And you mentioned automation, and that can be something that if you're automating everything in your business, what happens when it breaks, right? You've just completely halted your entire operations. And so that's not necessarily the answer, right, for everything either. Having a good balance between humans and automation is the way to go in the future with healthcare data.
Absolutely. And those of us that have used those automation tools, while they are fantastic, and certainly depending on the process you're using them for, can absolutely help streamline and make things more efficient. You're right too. They do break for
Mhm.
a variety of reasons. reasons. So you have to also have good backup plans. And I think, again, going back to human beings being in healthcare and being in the workforce, there will always be a need. There will always
Mhm.
be a need.
Hey, one of those needs may be that automation helps clean up your data.
Yeah. So, Carly, before we wrap up, what's something about working with healthcare data that you wish more people understood?
It's not easy. It is so complex. And what could be simple in theory and in concept when, discussing it with the business, it's not easy to implement. And so just understanding that, you know, the people doing that work, we're doing our best, we're doing it as quick as we can, right? It's so hard. And the data isn't always in a format. It may not be even captured the way we want it, captured at all for that matter. And so
Right.
sometimes we have to get really creative with what we're doing so that the business can get their desired outcomes for what they've asked for. So that's really, I think, the biggest thing for me is just it's not easy.
Yeah. No, and again, you are trying to bridge that gap between the healthcare knowledge and all of the nuances that go along with it and your understanding of data and statistics and everything else that you've studied. So, but I'm super thankful for people exactly like you. I don't know where we would be in healthcare without you. And, I'd like to add, behind every row of data is a real patient and a real experience. So again, to the point you made about PHI, it really all does point back to how do we make this process better and easier and more secure for the patients?
Mhm.
So anyway, Carly, this has been such a smart and thoughtful conversation. You've given us a real behind the scenes look at what it takes to build a culture of data. And I know a lot of people listening are going to walk away rethinking how they're using and trusting their data. And where can people follow you or connect with you if they want to?
You can connect with me on LinkedIn. I will say I'm not very active on there, but reach out I'll be more active in the future.
So you can find Carly on LinkedIn. And thanks again for joining us. And thank you all for listening or watching, however you choose to digest your podcast. Make sure you subscribe. You can find us on YouTube, Spotify, Apple. We'll be back next month with another episode. And until then, stay curious and keep leading with data. Thank you so much.